Your ankles may be trying to warn you. If you've noticed swelling around the ankles, tightness in your calves when walking, cold feet, tingling, cramps at night, or weakness when standing, I need you to hear this clearly. These are not just signs of aging. They are biological warning flags that your circulation, nerves, or vascular system may already be under stress. Most people ignore these signs for months or years until one day they realize their walking speed has declined, their balance has worsened, or their legs simply don't feel as reliable as before. But here's the good news. You don't need medications. You don't need surgery. You don't need to push through the pain. Today you're going to learn the 6 signs you must never ignore and the simple scientific home routine that can help restore strength, stability, and confidence to your ankles and calves, right from your own living room. If you felt like your legs aren't supporting you the way they used to, stay with me. Because what you're about to learn could change the way you move for the rest of your life. If you've noticed any of these symptoms, even if they seem mild, even if they come and go, even if you've told yourself it's just age, please listen closely, because recognizing these signs now could be the difference between a future of confident, independent movement or a future of limitation and loss of mobility. Your legs are not just limbs, they are your freedom. Warning sign number 1, swelling around the ankles. This is often the body's signal that fluid isn't being pumped upward efficiently. It may be related to circulation, veins, lymph flow, or sodium retention, and the earlier we respond to it, the more reversible it can be. Warning sign number 2, calf tightness or pain while walking. This can indicate reduced blood flow to the muscles, sometimes associated with peripheral arterial issues. When the leg does not receive enough oxygenated blood, walking becomes harder and steps become shorter. Warning. Sign number 3, tingling or numbness in the ankles or feet. This may be linked to nerve sensitivity, including early-stage neuropathy. When sensation declines, balance and stability are affected, and the risk of falls increases. Warning sign number 4, weak ankles or instability. If your ankles don't feel solid or your steps don't feel supported, that's often the result of decreased strength in key stabilizing muscles, especially around the ankle joint. The good news? These muscles can be strengthened at any age. Warning. Sign number 5, calf cramps or spasms at night. This can signal mineral imbalance, dehydration, or fatigue in the muscle tissue. Many seniors think this is normal, but it's not something to ignore. It's something to respond to. Warning. Sign number 6, cold feet or pale coloration. This may reflect low blood flow, especially to the lower extremities. Warm, richly oxygenated circulation is essential for leg health. And when the feet feel cold, the body may be conserving blood elsewhere. Now, if you recognized yourself in one or more of these signs, do not panic. None of these automatically mean disease, but all of them mean your legs are asking for support. And here's the empowering part. With the right movements, the right muscle activation, and the right foods, your body can improve circulation, rebuild stability, and restore strength to the tissues of the legs, even after years of decline. So, now that you know what the body has been telling you and you understand the signals to watch for, let's talk about the 4 simple movements you can do at home to strengthen the ankles, support circulation, and protect your calves gently, safely, and effectively. Now that you understand the warning signs your ankles and calves can reveal, let's talk about what you can actually do at home to strengthen them, restore function, and protect circulation. Because here's the truth, strong ankles, plus strong calves, stable walking, fewer falls, and healthier aging. And we begin with something simple, but extremely powerful. Exercise. Number 1. Calf raises, heel raises. The foundation of lower leg strength. Stand close to a wall or chair for balance. Lift your heels off the ground slowly. Then lower them back down with control. Do 10 repetitions, 3 sets. As you do this movement regularly, something remarkable happens inside your legs. Your calf muscles, the soleus and gastrocnemius, begin working as a natural fluid pump, helping move blood upward against gravity instead of letting it pool around the ankles. This exercise is scientifically linked to increased plantar flexion strength, which means stronger push-off, more stable walking, and reduced risk of ankle injury. Now that we've strengthened the calves, we shift to freeing the ankles themselves. Exercise number 2, ankle pumps plus ankle circles, the key to mobility and joint health. While sitting, gently flex your foot upward and downward. This is your ankle pump. Do 10 repetitions, 3 sets for each foot. Then rotate the foot in a slow circle, first clockwise, then counterclockwise. Do 10 repetitions in each direction, 3 sets per foot. These movements stimulate circulation inside the joint capsule. They nourish the connective tissues, and they improve proprioception, your body's sense of position and balance. This reduces stiffness, reduces risk of sprains, and maintains joint fluidity, something absolutely essential as we age. And now, we target the biggest enemy of ankle and calf health, the silent force behind swelling, gravity. Exercise number 3, legs elevated above the heart, your edema reduction position. Lie back comfortably. Place your legs on a pillow stack, sofa, backrest, or wall, ensuring the feet are higher than the heart. Hold this position for a minimum of 15 minutes. During this time, the venous system finally gets a break, allowing fluid to drain out of the ankles and lower legs. Many seniors don't realize that this position alone can drastically improve circulation, reduce nighttime swelling, and help combat the heavy, tight feeling around the calves. This is not passive rest. It is an active repositioning of fluid movement. Once the calves have strength and the ankles have mobility, and excess fluid has been drained, we finish by teaching your legs how to function dynamically in real movement. Exercise number 4, functional lower limb activation. How your legs relearn motion. You may choose marching in place, 10 steps per leg, 3 sets, or walking, at least 15 minutes at a comfortable pace. This trains the neuromuscular pathways involved in balance and propulsion, improving stability, improving stride quality, and enhancing the muscle pump that prevents blood from stagnating in the lower limbs. Regular functional motion reduces calf cramping, improves temperature regulation in the feet, helps prevent circulation-related ankle discoloration, and supports confident, upright movement. Doing these movements regularly, strength for the calves, mobility for the ankles, drainage for the fluid, and activation for real-world walking. You're addressing the root causes of the 6 warning signs, not just the symptoms, but there's one more element. And the Spanish flamenco dancers understood this deeply. Movement strengthens the legs from the outside, but the right foods strengthen them from the inside. So now, let's move into the nutrition that supports ankle and calf health at the cellular level. Now that your ankles and calves have been activated through movement, we support them from the inside with nutrients that directly affect blood flow, muscular control, elasticity, and tissue repair. We begin with something soft, rich, and deeply supportive to ankle function: avocado. The potassium stabilizer. Avocado provides one of the most effective minerals for muscle coordination: potassium. Potassium influences nerve messaging to the muscles, which helps prevent ankle weakness, cramping, and electrical misfiring during movement. For seniors who experience nighttime calf cramps, tightness while walking, a feeling of instability around the ankle, or difficulty rising on tiptoe, potassium helps the muscles fire correctly, so every step becomes more controlled and more confident. Once the muscles are firing properly, we support the structures that hold the ankle together. Walnuts, ligament and tendon nourishment. Walnuts supply omega-3 precursors, manganese, and amino acids that help nourish the tendons and ligaments around the ankle, including the Achilles tendon, lateral ankle ligaments, and the deeper stabilizing connective tissues. For seniors who have loose or wobbly ankles, history of sprains, reduced lateral stability, soreness around the Achilles, the nutrients in walnuts help restore the microfibers of connective tissue, improving elasticity, strength, and springiness of the joint. Now that the structure is supported, we improve inflammation and muscle endurance. Sardines, omega-3 for muscle preservation. Sardines offer one of the most dense natural sources of omega-3 fatty acids, which help reduce inflammation in the muscles and improve the endurance of calf tissue, especially the soleus and gastrocnemius. Omega-3 support leads to reduced tightness during walking, improved muscle oxygenation, smoother circulation, and protection against age-related muscle wasting. For ankles and calves specifically, this means stronger push-off, better propulsion, and a more youthful walking pattern. And finally, we look at something essential to the very material of the ankle: kiwi, orange, vitamin C for collagen repair. Vitamin C isn't just about immunity. It's one of the primary catalysts for collagen synthesis. Collagen forms the internal structure of ankle ligaments, tendon sheaths, connective tissue, and even the lining of blood vessels. For seniors with weak ankles, slow recovery after walking, tendon soreness, or subtle stiffness in the lower legs, vitamin C helps rebuild and maintain resilient connective tissue, literally helping the ankle reinforce itself from the inside. And here's the beauty of this nutrition strategy. Avocado supports muscular firing. Walnuts fortify tendons and ligaments. Sardines preserve muscle function and reduce inflammation. Kiwi and oranges rebuild collagen and support recovery. When these foods are included regularly, your ankles and calves stop feeling fragile and start feeling stable, capable, alive again. And now, you're ready for the final step of today's session. Before you go, if this video helped you better understand your ankles and calves, even a little, please don't forget to like this video. It tells YouTube that seniors need this kind of information, and it helps this message reach someone who might be suffering silently. And please, share this video with a friend or family member who has swollen ankles, walks with instability, has calf cramps, or is losing confidence in their mobility. You might literally help prevent a fall. You might help someone regain the independence they feared was slipping away. Now tell me in the comments, which of the 6 warning signs have you experienced, and how long has it been happening? Your comment might guide someone else who is scared, confused, or unsure if what they're feeling is normal. And finally, subscribe to Better Legs, Better Life, so you never miss another lesson, another tool, another strategy that keeps your mobility strong and your steps confident. Because listen to me, every day you stay active, every day you learn about your body, every day you choose movement over fear, you're rewriting the story of your aging, not toward decline, but toward strength. Keep moving, keep smiling, and never forget, you've got this.